Welcome to the Heart Guardian podcast for Healthy Heart. I'm Dr. Aman Kapoor, your host. Join us on this journey towards healthier heart. In partnership with Maharashtra Institute of Health Sciences, Chair of Preventive Cardiology and Madhavbaug Institute of Preventive Cardiology, we are here to provide you with valuable insights and tips for keeping your heart healthy. Our goal is to empower you with latest information on heart health, prevention strategies, and overall well-being. We will cover various topics including risk factors, lifestyle diseases, and advancements in preventive cardiology. With the support of our expert team, we will guide you towards informed decisions for keeping your heart healthy. Whether you're looking for preventing heart disease or managing your existing conditions, Heart Guardian is your companion. So sit back, relax, and join me in this journey towards keeping your heart healthy. Let's join with our expert today and understand how you can make your heart healthier with the Heart Guardian. Today we're going to talk about a topic that is very scary to most of us and can shake the most hard person, the topic of heart attack. Well, let's think of it like this. Among all of the health issues out there, a heart attack may not be as bad as it seems. In fact, many people recover well, and here is the exciting part. We have with us Dr. Jagdish S Hiremath, renowned cardiologist, the chair of MUHS, and a real expert who is going to guide us through this topic. So stay tuned and let's move over to Dr. Jagdish S Hiremath, sir, who will guide us what to do, how to take care of ourselves, how to prevent, and everything about heart attack. Sir, over to you.
Heart attack. Heart attack is usually perceived as a sinister word. But at the end of this pod, you'll realize that amongst many human diseases, it's a palatable disease and it has excellent treatment. Success rates are very high, and getting back to normalcy in a very high percentage of population is possible. Also, preventing heart attack can be effectively executed. By now, we are familiar with the word atherosclerosis. It is a process by which medium-sized arteries, about 3 to 6 millimeters, of the heart, of the brain and the kidneys, leg muscle get clogged by LDL cholesterol, that's the bad cholesterol. This slow-growing process goes on for years till it causes a significant blockage, about 75 to 80%. The cholesterol buildup is firm and hard. A soft blood clot gets on the top of it one fine morning and blocks what was 60% to 100% or 80% to 100%. The sudden worsening of the blockage and occlusion of the artery leads to all the sinister symptoms that we know: chest pains, the sudden death, and rushing to the hospital and getting treated. Before this, however, atherosclerotic process is ongoing for a number of years. Atherosclerosis affects people who are generally above the age of 40. The risk factors like diabetes, blood pressure, tobacco consumption, obesity, mental stress, high blood levels of LDL cholesterol, aggressive or type A personality are all well-known risk factors. In addition, advancing age, male gender, strong family history, or hectic lifestyle are also considered risk factors. The risk factors don't add to each other. They exponentially increase the risk of development of these blockages. For example, a diabetic person who is hypertensive, who is overweight, smokes, has high cholesterol, and is not on any preventive medication, has family history, will have 64 times more chance of developing heart attack as compared to somebody of his age without these risk factors. The ischemic heart disease or coronary artery disease or atherosclerosis of the arteries leading to the heart constitutes about 13% of all the adult population. Of this, most of the people suffer a heart attack at some point of their journey of atherosclerosis. 90% of the heart attacks can be explained on the basis of the risk factors that we discussed just now. However, 10% of the heart attacks still is a mystery to science. Sometimes a very young person in the age of 20 comes with a heart attack, or sometimes a person who doesn't have any risk factors, has a good, healthy lifestyle, also suffers a heart attack. This is a gray area, fortunately only 10%. Science will explore it, and one day I'm sure we'll have the answer for this question also. When a person is developing blockages in the arteries, and when the block reaches about 75% of the major artery of the heart, it leads to a symptom called angina. Angina is a chest discomfort, chest pain, suffocation, uneasy feeling, all in the chest, upper chest, both arms, one arm, jaw, or in thereabouts. The moment there is symptom of this nature, which comes on exertion and is relieved by rest, one has to think of blockages in the coronary arteries. Apart from these classical symptoms, there could be other variants which could be left for the doctors to decipher. In contrast, the heart attack symptom is explosive. This area of the heart is now undergoing acute damage. The artery is 100% blocked. Imagine the artery which every doctor checks at the wrist is tied off. The palm of the hand then will go black and blue and will be extremely painful unless the flow of the blood is re-established. Same happens to the heart muscle. When the coronary artery is completely blocked, the symptoms are of acute chest pain, back pain, jaw pain, sweating, vomiting, sometimes a collapse due to sudden cardiac arrest. When such a symptom occurs, it is reflected on the ECG and a blood test called the TROP test. There is a period of about 3 hours before the artery can be opened, ideally so that the part of the heart can be saved. Because of this time window of 3 hours, it is important rushing to the hospital where there is an ICU and a cath lab facilities where angiography and angioplasty can be performed. When such a heart attack is recognized at home, one should make quick arrangements to move to the hospital rather than waiting for a doctor to come home and take an ECG. On the way to the hospital, certain first aids are possible. A soluble aspirin, the tablet called Dispirin, can be used dissolved in water. Sometimes heart patients have a tablet called Sorbitrate with them that can be put under the tongue. A person who is moving to the hospital, if he starts getting drowsy, start profusely sweating, all these indicate low blood pressure. Rhythmic cough can be advised to this individual to keep the blood pressure up and to reach the hospital in a decent shape. Once a person reaches the hospital and a diagnosis is made by ECG and echo and blood test, a procedure called PAMI is performed. PAMI is taking the patient directly to the angiography angioplasty cath lab and looking at the arteries where the block is. If the block is recognized as 100% or critical, one can open up this artery with the help of angioplasty. The blood clot is sucked out and a stent is put in most of the patients to establish the flow. There are instances where rather than performing a PAMI, clot buster lytic blood thinner is given to the patient. This dissolves the soft blood clot, opens the artery and saves the heart, buys you time. In the next 6 to 24 hours, angiography can be performed at a bigger center and if required, angioplasty can be done. The most effective treatment of the two is the PAMI, but facilities may not be available in many places, so the lytics are of great help. By a PAMI or a lytic, the artery is opened up and the heart muscle is saved. The left ventricular pumping capacity is known as LVEF, left ventricular ejection fraction. That remains intact if the artery is opened up and heart muscle is saved. If there is delay in opening of the artery, that part of the heart gets damaged permanently. and even an angioplasty done later is of little use. If damage takes place and heart becomes weak where the ejection fraction is below 40% instead of a normal 60%, these individuals will have different course in the future. However, those who survive heart attack effectively, arteries opened up and the left ventricular pumping is preserved, they have an excellent outcome. The rehabilitation and prevention effort of future attacks should be excellent. A lifestyle of correct diet, moderate exercise, controlled weight, blood pressure, sugars, and the bad LDL cholesterol, all these have to be executed. Some medications like the blood thinner aspirin, cholesterol-lowering drug called statins are then lifelong. If such a treatment is offered, heart attack is a much better disease to have than an injury of the spine or a joint which makes you immobilized for a number of weeks. Many of the heart attack victims can go back to work within 1 week and can completely be rehabilitated in all aspects of life within few weeks. Heart attack treatment can get delayed due to not recognizing the symptoms, not reaching the hospital, no facilities available, and some socioeconomic reasons. Less than 10% heart attacks can be silent and get recognized in a routine test sometime later. The crux of the matter is prevention of heart attack. The process of atherosclerosis can be prevented by leading a healthy lifestyle, checking your parameters like sugar and cholesterol, abstaining from smoking. These are all well-known advices, but they have to be followed well in day-to-day life with remarkable sincerity and in a light-hearted manner. Supporting friends and families in maintaining a lifestyle goes a long way. Out of 100 heart attacks, about 5 succumb to cardiac arrest in the first few hours. The success rate of PAMI and clot buster treatment is effective in almost 90% of the patient. Thus, remaining well after a heart attack is possible in more than 85% of the cases. Like all other aspects of life, this information needs to get translated into knowledge, awareness, and finally, wisdom.
Thank you so much, Dr. Jagdish S Hiremath, sir, for generously sharing your expertise and insights with us today. Your valuable contributions have brought immense value to our discussion and inspired us to prioritize our heart health and take proactive steps towards healthier heart future. Now, armed with this knowledge gained from this conversation, I'm sure, friends, it's time for action. Embrace the power you hold to make positive changes in your life, nurturing the well-being of your heart. Remember to stay connected with us by subscribing to our podcast, following us on social media, and you can find a wealth of resources in the upcoming episodes filled with informative discussions and practical tips to support your healthy heart. Thank you for being an essential part of Heart Guardian podcast for healthy heart. Together we can make and create a future where our hearts beat stronger and we live life to the fullest. Our heart and your heart matters. We are here to support you in every way. Goodbye for today.